Welcome to Adapt NCLEX. One of the ways to get points for the NCLEX is to not to miss question on health promotion. These are straightforward questions. If you know the concept, you master it. Today, we're going to talk about reproductive aspect of maternity. These questions are straightforward, but they can be tricky. I have 12 questions. I want you to focus on the concept. Focus on the concept I'll give you. Write it down. 12 questions. We start with the next generation, followed by SATA question and a regular question. Grab a pen and paper. Get ready. Keep track of your score and pass it. First question. As usual, like I said, next generation. You see this question, you feel like you defeated. I know you know it. Just click on it, read it, and see what is the issue. Client in an OB clinic who present with what? Report anxiety, episode of what? Rage, prior to what? The menses. Therefore, that's the key. Something happened before I have my menses. The client states the symptoms interfere with work and has caused strain in the relationship with their spouse. This is the issue. Something will happen. What's that? Anxiety and rage. These are mood disorder before you have your menstruation. And then after that, it goes away. The symptoms resolve after menstruation. The client denies suicide ideation, but there's another buzzword. It's affecting the individual life. There is impairment in relationship and work. At the same time, you have mood disorder before you have your menses. What do you think? And it goes away. There is no suicidal ideation. Is this premenstrual syndrome, PMS? Is this premenstrual dysphoric disorder, generalized anxiety disorder, or major depressive disorder? There's a clue there. Stop the video, pick your own answer, think about it, use test-taking strategy, look at the answers, and then pick your answer. But I can tell you, we have a patient with signs of what? Depression, anxiety, rage. These are all mood disorder before they have their menses. And it's also affecting their lifestyle, relationship at work and at home. But this goes away right away. It can be major depressive disorder. This is associated with what? Their menses. It cannot be generalized anxiety, even though I have an anxiety associated with menses. Now you left with this. Premenstrual syndrome is the benign portion of it. It should not affect your life, your relationship, and work. So it's a mild form of what? Premenstrual dysphoric disorder. If there is any work-related issue, relationship with your spouse, and evidence of what? Depressive symptoms, anxiety, mood disorder, this become premenstrual dysphoric disorder. Another way to think about it, all the other answers as a disorder that tell you it's a collection of symptoms, something that is greater than what you have. This one does not have. Premenstrual syndrome is what you see, the same bloating, the same nausea, all the mild symptoms you feel before you have your menses, and it goes away. But it does not affect your relationship or work. So that's your first answer. Pay attention. NCLEX will do that to you. Know the key concept, and I want to know them. Now, select or apply. This may be difficult, but I know you know what to do. Don't over-select. Pay attention to the keywords, and then use the keyword, the buzzword in the question to answer the question. What is the question? A nurse is reviewing prescription, what? For a client with what? History of toxic shock, what? Syndrome, who is seeking contraception. Which of the following prescription should the nurse question? Select or apply. Cervical cup, diaphragm, male condom, combined oral contraceptives, vaginal contraceptive sponge. Stop the video, pick your answer, and let me know. Then I'll break down the question for you, and you see how the answer choice will pop like a candy. You pick your answer? I know you pick it. Now, go back to the question and figure out what you're being asked. Select or apply. Don't over-select. Which of the following prescription? The next question. I got a question about what? Patient has a history of what? Toxic shock syndrome. You have to know a little bit about it. But even if you don't know, something shock, a sepsis, whatever, I don't like it. Toxic means sepsis related to shock, right? So shock, basically you have septic shock. And they're trying to take what? Contraception. Which one will be best for them? The key is what? Anything you can leave in the vagina is going to cause sepsis. That's how you can find your answer. So write them down. Toxic shock syndrome. If they said which contraception is safe, if you can leave the contraception in the vagina, don't give it to the patient. Cervical cup, you leave it in the vagina. Diaphragm, you leave it in the vagina. Condom, you don't leave it in the vagina. It's a male condom. It's female. It's different from female condom. Combined oral contraception, you take it by mouth. And vaginal sponge, you leave it in the vagina. Therefore, ABE is your right answer. That is all you need to know, that if that can leave something in the vagina, then it's going to cause toxic shock syndrome. And this is the key word. Anything left in the vagina, say no to toxic shock syndrome. That's the key word. And as he's teaching a client, select or apply. This is reproductive NCLEX question, maternity portion of it. And we're doing health promotion. And as he's teaching a client, diagnosed with what? Premenstrual dysphoric disorder. I just want to give you more content related to the question we saw, number 1, about management. Now you know what premenstrual dysphoric disorder. You know the signs and symptoms, therefore you can manage them, but don't get trapped. Which of the following interventions should the nurse include? Remember, premenstrual dysphoric disorder is different from premenstrual what? Syndrome. Which of the following interventions should the nurse include? Select, apply. Initiate selective serotonin reuptake inhibitor, SSRI. Increase caffeine intake. Begin combined oral contraceptives. Limit your sodium intake. Use relaxation technique. It's a select and apply. Don't overselect. If you know what you want, pick it and move away and keep track of your record. Let me know about your score. Put it down at the end of it. What do you think? You pick your answer? Yes, I know you pick your answer. Therefore, what do you think? What answer choice do you pick? We all know premenstrual dysphoric, there is a mood disorder associated with it. It's a severe form of PMS. Therefore, what are you going to do? Mood disorder, they get the SSRI. Caffeine is going to worsen the situation. They will need combine what? Oral contraception to control their menses. It helps with that. Regular, well-predicted menses. Limit sodium. This is a trap. Limit sodium is good. Use relaxation technique is good. But they are for what? Premenstrual syndrome, the PMS. This is the easy one, the milder form of it. And you decrease caffeine, you lower your sodium, you eat some crackers, but you don't use it to treat premenstrual dysphoric disorder. This become a mood disorder. So you focus on medication. This is NCLEX trap. Don't pick it. You're more likely to pick D and E, but there is a distinct difference between the two. So this one, only 2. So don't pick it. And then she's teaching a client who has what? Thick, white, cat-like vaginal discharge, and is prescribed what? Miconazole vaginal cream. Which statement by the client indicate a need for further teaching? Select or apply. I can Dutch daily to help clear the infection faster. I should insert the medication at bedtime. I should avoid sexual intercourse until treatment is complete. I should insert the medication high in the vagina using applicator, and my partner will need to be tested and treated. I will guide you to pick the answer. I intentionally said this question to give you some next generation flavor, at the same time critical thinking. Focus on this and find out what this is. And the patient is prescribed this medication. And the two combine it together. It's a select or apply. Don't over-select. If you know only one, pick it. Then I'll explain it to you. You pick your answer? I know you pick your answer. Stop the video. I know you stop it and pick your answer. Now, thick, white, cat-like vagina discharge. This is what? Even if you don't know, look at this medication. Miconazole. It has a ZO. This is always antifungal. Therefore, if I'm prescribed antifungal, this may be fungal infection. This thick, white, cat-like, vaginal discharge. This is yeast infection. That's all. So patient has yeast infection, prescribe antifungal. How do you treat it? Need further teaching. That's another word. Now pick your answer. I know you already picked your answer. Touching is wrong. Need further teaching. I should insert the medication at bedtime. Yeah, you want the longer exposure. So bedtime is the best way to give you the medication. I should avoid sexual intercourse until treatment is complete. Yes, because it causes irritation. So you should avoid sexual intercourse. I should insert the medication high in the vagina using applicator. They give you an applicator. You got to put it all the way up. Therefore, this is good. My partner will need to be tested and treated. This is a misconception. You have to emphasize this. Otherwise, there's going to be a problem in the house. My partner will need to be treated and tested. No. Yeast infection, it's not sexually transmitted. It's not STI. Therefore, the partner does not need to be treated. NCLEX will do that to you. It's a misconception. Every time they give you yeast infection question, watch for that. You don't need to be treated, partner. And this is obtaining health history from a young client who is taking estrogen-based oral contraception. Which findings should the nurse report to the healthcare provider immediately? Risk reduction. That's the risk reduction question. That means you want to intervene quickly, right? Selected apply. Breast tenderness, intermenstrual spotting, breast nodule, migraine headache with horror, amenorrhea, and mood changes. What do you think? Pick your answer. Stop the video, select your answer. Think about the question. Go for the buzzword. And now, let me show you the right answer. It's immediately. This is a risk reduction. If I see something, I got to intervene quickly before the patient gets sick. Patient is taking estrogen-based contraception. You know estrogen-based contraception are bad, right? So which one should the nurse report? Remember your eggs. Eggs is the estrogen-based what? Contraception. They cause what? What do you think? Abdominal pain. They cause chest pain. They cause headache. They cause high pain and leg pain. DVT. So when you see those things in eggs, that's estrogen-based contraception. You're going to have breast tenderness expected because the breast getting engorged. You may have spotting expected. Breast nodule is breast cancer. We have a mass now. It leads to breast cancer. We don't like it. Migraine with horror, this can lead to stroke. So when you see headache with migraine with horror, mostly you got to intervene. Amenorrhea, yeah, sometimes when they give you contraception, you're not going to have your menses. And the mood changes is very common. Don't pick it. So only two answers there. If you select more than that, you get 0. But these questions are designed for critical thinking, reproductive, English questions, maternity nursing, based on health promotion aspect of your test. And this is provided teaching to a client diagnosed with what? Genital herpes. This is also common English trap, misconception caused by herpes simplex type 2. Which statement by the client indicate correct understanding of the teaching? That means they know what is going on. They have herpes, right? Type 2 is a genital one, not the oral one. So what do you tell them? Contagious only when there is a lesion present. Using condoms will eliminate transmission risks. The infection can be cured with treatment. I should avoid sexual contact during active outbreak. Antiviral medication can help reduce the outbreak. I should inform my sexual partners about my diagnosis. I can transmit the virus even when I don't have symptoms. I give you all the options the NCLEX will give it to you to trap you. I think about all the options available that you have misconception about herpes. People have herpes, and this is classic. So pick your answer. I want to know what you got. Question 6. What were your options before I reveal the answers? And let me know. If you know them, that means you master them. And if you go do any questions anywhere and you see herpes simplex 2, you'll see those answers because those are classic way. You pick your answer. Now, let's go back. As usual, I like to break down the question to you so that you can see what is going on. It's a correct understanding. I will underline it so that I can see in my head so that I don't pick the wrong one. Teaching, I have herpes. Okay, Herpes, number one, you are contagious whether there's a lesion or not. So there's an active where there's a lesion, and there's a latent where there's no lesion. So active and latent both cause problems. So I am contagious only when there is what lesion present. No. Using condom will eliminate transmission. If you pick this answer choice, it's okay. But the test, NCLEX test can do that to you. You have to watch for every word. There's no, in medicine, nothing is 100% absolute. You cannot eliminate transmission by wearing condom. You would reduce the risks, but there is no elimination completely. Condom is not 100%. So this one is fine. You see, that's how we're breaking down the question. The infection can be cured with treatment. No, if you take acyclovir, right, what is it going to do? It's going to decrease. Antiviral medication decrease the severity. Like the same thing. When you take flu vaccination, you still get flu. Same thing. If you take this medication, antiviral, to help with the reduce the severity and the recurrence, but it does not cure you. The virus is there forever. If you have herpes simplex, it's there, it's gone, it's embedded in your DNA. You cannot take it away. Therefore, I can cure you. As you avoid sexual contact during what? Active outbreak. You see, this and A are talking about the same thing. So this is good. Antiviral medication can help reduce outbreak. You see, I try to trap you so that you can think. I don't put antiviral here, but it's the same thing. I say infection can be cured with treatment. And now I give you the right answer. Antiviral medication can help reduce your outbreak. It does not eliminate. I should inform my sexual partners about my diagnosis because it's an STD. It's not going away. I can transmit the virus even when I do not have symptoms, which is opposite to question answer one. I'm contagious only when the lesion is present. And this one said, I can transmit the virus even when I don't have symptoms. That means if you're asymptomatic, you still have what? The virus. That means the virus does not go anywhere. It sticks with you forever. And therefore, correct understanding is D, E, F, E, H. And this is evaluating the effectiveness of clomiphene therapy, which finding indicate the medication is working. You have to know what is clomiphene. Decreased estrogen level, onset of ovulation, absence of menstruation, and weight loss. If you watch the previous reproductive question number one on the other video, which I will link you to this, we talk about clomiphene. You use it to what? What do you think? Pick your answer choice. Used for have babies. You have multiple pregnancies. You may have 3, 4, quadruple, multiple times. It's used for people who have infertility and want to let them have baby. Therefore, if it's working, well, you're going to ovulate so that you can have baby. It has nothing to do with your estrogen. You're probably going to increase it. Absence of menses. You may be pregnant or hormonal change. It has nothing to do with weight loss. And this is caring for a client who's taking combined oral contraception. We talk about aches, right? The client reports severe leg pain and new shortness of breath. This is your aches, right? Which action should the nurse take? Oral contraception. You have what? Leg pain, shortness of breath. That's aches, right? Bad thing has happened. What would you do? Prioritization first. Reassure the client that these are common. Notify the healthcare provider. Suggest switching to what? Progesterone only pills, and recommend taking a break from the pills for 1 week. You have to see these kind of traps, all the answers, but you have to focus on the key. What is happening to the patient and what the question is asking you. Do something first. If you have to do something first, what do you think you should do? Common sense question, right? Prioritization can be common sense, right? Which one you pick? Don't pick number one. Doing something first. I have what? Shortness of breath and leg pain. That means I got to intervene right now. Something that will save the patient life. Switching to another medication. You're doing the same thing as A. You're not addressing the problem. Stop taking the medication for a week. You're still not addressing the problem. Let the doctor know and let him deal with it. Patient has DVT and PE. And this is providing district teaching to postpartum client who's breastfeeding. The lady is breastfeeding, right? The client state is designed to avoid hormonal contraception method that may affect what? Milk production. Therefore, does not want to take pills that will affect milk production. You have to know which pills affect what? Milk production. This is home health promotion. This is very, very important. That's what the mother will ask you, which contraception is very good. You take it, but at the same time, either you take it, you have a patch, whatever, it cannot affect what? Milk production. Combine oral contraception, progesterone only mini pill, vaginal ring, and contraceptive patch. Write this concept down after you pick your answer. Write this down after you pick your answer. If they said no milk production, it should not have estrogen in it. Combined medication have estrogen. Vaginal ring has estrogen in it. Patch has estrogen in it. Only progesterone only does not have estrogen. And then she's providing teaching to a client who has what? Endometriosis. Which statement by the client indicate the need for further teaching? What is endometriosis? I may experience pelvic pain during menstruation. I might have pain during sexual intercourse. This condition can increase fertility. My symptoms can be managed with oral contraception. Don't get trapped. You know the answer. I change the words to trap you so that but if you focus on the keywords, you pick the right answer. You pick yes? I know you pick it because we need further teaching, right? Endometriosis, there's certain things associated with it. It causes pelvic pain during menstruation, due to scarring. It causes sexual intercourse pain because of scarring. It does not increase fertility, decrease fertility because of scarring of the fallopian tube. And you can take birth control to regulate your menses. Know that. 11, two more questions. This is a very hard one. It's a critical thinking. If you don't know, stop the video, write the concept I'm going to tell you, but pick your answer choice before you proceed. And nurse is providing an intake history at the OB clinic. Which client should the nurse recommend for pap smear? What is the recommendation for pap smear? These are health promotion stuff. You got to get it at the tip of your finger because I told you, you can grab this point and move on. 19-year-old who is sexually active. 21-year-old client who has a normal pap smear 3 years ago. A 30-year-old who has a pap smear 1 year ago and then results was normal. And a 65-year-old who had a pap smear be normal all her life. What do you think? Pick your answer. Think about it carefully and don't let me trap you. You pick your answer? I can tell you, write this down. Everybody get past smear 21 years, whether you are sexually active or not. If you're sexually active before 21, you're more likely to have HPV, which can increase your risk of cervical cancer. But everybody get what? Pap smear starting 21, whether you were socially active before or not. Then 21 to 39, you're going to get it every 3 years. Until 65, after 65, you stop. Therefore, 19-year-old, not ready, whether they are sexually active or not. 21-year-old, you're supposed to get it. Had it 3 years ago, therefore, the next one is due now. 30-year-old had one pap smear a year ago, still not due. 5-year-old has had it for multiple times. She's 65 and above. She doesn't need any pap smear. If you get it wrong, it's okay, but you got to do the analysis. Okay, and that's the concept here for you. And the last question. A client has decided to use a cervical cap contraception. This can be very tricky question. Cervical cap, there's so many things about it they can ask you. So take a pen and paper and write this contraception down. When instructing the client in the correct use of this method, which action should the nurse include? Insert the cap no longer than 3 hours prior to intercourse. Apply the spermicide to the outside of the cap. Remove the cervical cap within 6 hours after intercourse. Reapply spermicides with repeated act of intercourse. It's a trappy question. It's a trappy concept. People forget about it, but this is very important. So write it down. Which answer choice you think you want to pick? I can tell you, cervical cap, the misconception is this: insert the cap no longer than 3 hours. There's no limit. So far as it's there before intercourse is good. So when you put the limit there, you got to put it 3 hours before. It's wrong. There's no limit. So one is wrong. Apply this spermicide to the outside. It should be applied inside because that's where the sperm will go through, and then the spermicide will kill it. So you need to insert inside the cream, inside the spermicide, inside the cap, not outside. Remove the cervical cap within 6 hours. The within, that means after intercourse, within 6 hours, you should remove it. No, you should keep it minimum of 6 hours and not past 48 hours because things can happen. Reapply spermicide with repeated act of intercourse. By default, this is why, because every time you use it, it becomes ineffective. You can leave the cap still in and apply the spermicide because you need to take it with the spermicide. 12 questions: maternity nursing, health promotion, reproductive, NCLEX practice questions and answers, test taking strategy. Adapt NCLEX video help you. Put a little bit of comment in the comment section. Give us a thumbs up and subscribe to Adapt NCLEX for more content. And the screen, you'll see another video coming. It's part 1 of this one. And you can watch both. And I know you've mastered reproductive of the NCLEX. Thank you. Bye.